Good morning. Welcome to the revision classes of Biochemistry of Cancer. So you have seen a good number of classes in Biochemistry of Cancer, and from today onwards, in 3 classes, we will review all the things that were told to you, taught to you all the way. So, cell cycle, you should have a clear outlook about the cell cycle, about which the biochemistry of cell cycle is repeatedly told to you in your physiology classes and anatomy classes also. The term cell cycle refers to the events occurring during the period between 2 mitotic divisions. So, it's divided into G1, that is gap 1. S, synthesis, G2, gap 2, and M, mitosis. So these are the phases: G1 phase, S phase, G2 phase, and M phase. So cell division is taking place in M phase. Daughter cells then enter either into G0, that is dividing or dormant stage, or re-enter the cell cycle when there is necessity for growth and repair. So in a normal cell population, most of the cells are in G0 phase. General metabolic events are taking place in G0 phase. So this is the cell cycle. So you can go from G0 phase, and then the chromosomes are duplicated, and the G2 phase. M phase is mitosis, division of nucleus, and daughter cells will form. Then G1, like that. So you have to have a clear-cut idea about this, and synthesis of DNA will be occupying the most of the time, that is in S phase. So cell cycle phase total 20 to 22 hours. So these are the checkpoints where it is cut into M phase, G1 phase, S phase, and G2 phase. So the ultraviolet rays are the one that will be unnecessarily disturbing the cell cycle. So cell cycle controls or checkpoints we call it. So important check occurs in 3 stages, that is G1 and S transition during S phase or M boundary. Of this, G1 phase checkpoint is more complex and it is under strict control. There are 4 types of cyclins, A, B, D, and E, and 5 different cyclin-dependent kinases: CDK1, CDK2, CDK4, CDK5, and CDK6. So these are the cyclin-dependent kinases. They control the entire cell cycle. Cyclins are so named because they are synthesized throughout the cell cycle and are abruptly destroyed during mitosis. Cyclins activate CDKs, which phosphorylate specific substrates. These specific substrates are regulatory proteins. ATM is a protein kinase which is associated with DNA. If a break in DNA is produced due to ultraviolet light, the ATM is dissociated, activated, and then initiates a series of cascade reactions. The CDK2 cyclin E complex directs the cells in G1 phase to enter into S phase. So oncology. Oncology is a branch of medicine that deals with etiology, diagnosis, treatment, and prevention of cancer. And to become oncologist, one should complete MBBS and get into general medicine MD, and then he has to go into super specialty of oncology. Medicine and oncosurgery also is there. Onco means Greek word meaning tumor. So the people, oncologists specialized in cancer medicine and treatment, will be treating with various biomolecules, the various types of cancers. Oncosurgeon deals with surgical management of cancer. So debulking was one of the, in good olden days, debulking of the tumor was one of the chances we used to have. But nowadays, we need not go for debulking. We can go for the selective excision of the tumor. So what is cancer? What causes cancer? How is cancer diagnosed? Can cancer be prevented? What is the link between genes and cancer? These are all the questions that generally everybody should have. And you are the students at your stage, you should be knowing all these answers, and your people will be very happy if you speak to them. So unregulated cell division leads to cancer. Cancer is uncontrolled growth and cell proliferation, resulting in a mass, that is tumor, that invades neighboring tissues and metastasizes to more distant sites. Some cancers, such as blood cancers, do not form in a tumor. They will be liquid, they will be in the liquid form, in the blood form. The cells will be growing and multiplying. They will form blood cancers. Cancer is one of the most common and severe problems of clinical medicine. So normal cells have controlled cell proliferation, whereas cancer cells have uncontrolled proliferation. Normal cells have contact inhibition. Cancer cells don't have any contact inhibition. Normal cells have normal nucleus. Cancer cells have abnormal nucleus. Normal cell got organized single layer. Cancer cells are disorganized and multi-layered. Normal cells have differentiated cells. Cancer cells, non-differentiated cells. They don't have fixed shapes and sizes and functions. So there are metastasis and angiogenesis also will be there. Growth of new blood vessels will be there. Cells will be migrating from one place to another place. And apoptosis is a normal mechanism for normal cell, but cancer cells never die. They will be going on multiplying. They don't undergo apoptosis. So normal cells have telomerase activity stops after 50 cell cycles. When the cell continues to divide up to 50 cells, then the telomerase activity stops. But in the cancer cells, the telomerase activity is increased and persistent throughout. So loss of normal growth control is in the normal cell division, cell damage and cell suicide or apoptosis is normal. But in cancer, the cell division will be going on increasing, first mutation, second mutation, third mutation, fourth mutation, and resulting in uncontrolled growth. So normal regulated cell growth is depicted by the above picture, and uncontrolled cell growth is depicted in the picture below. So cancer cells are characterized by three properties: unrestrained control of growth, immortality, invasion of local tissues, and metastasis. So biomedical importance is second most common cause for death worldwide is the cancer. Humans of all the ages are affected by cancers. A wide variety of organs are affected by cancer. So broad cellular mechanisms is the sustaining proliferation of the signals, evading growth suppressors, activating invasion and metastasis, enabling replicating immortality, inducing angiogenesis, new blood vessel growth, resisting cell death. All this leads to the cancer. So nomenclature of cancer, different names are given. Some common names are the leukemias. They progress through the bloodstream. Lymphomas, they progress through the lymphatic spread. Some common sarcomas in the fat, in the bone, in the muscle. The muscle sarcoma, bone sarcoma, and fat sarcomas. And colonic cancers, transverse colon cancer, descending colon cancer, they will do hemicolectomy. As far as the colon is infected, they will be taking it out. The oncosurgeon will do it carefully. In the bladder, in the prostate, all these places are commonly affected with cancer, and these are the nomenclature for cancer. So cancer, adeno means that is pertaining to the gland. Chondro means that is pertaining to the cartilage. Erythro means that cancer is pertaining to the red blood cells. Anangio, that prefix tells that it is pertaining to the blood vessels. Hepato, that prefix indicates that it's a liver cancer. Lipo, that indicates that it's a cancer in the fat. Lympho, that mentions that it is affected by the lymphocytes. Melanoma, that it's a pigment cell cancer. Myelo, that it's affecting the bone marrow. Myo, that it affects the muscle. Osteo, that it affects the bone. These are all the cancer prefixes, and they point to the location if you know the meaning like this. So example of normal growth. Dead cells are usually shed from outer surface. The epidermis will come into the dermis, normal outer surface, and the dividing cells in the basal cells will migrate into the epidermis and the epithelium. And from inside the dermis, blood vessels will be seen. So tumors can be of two major types. Benign tumors are generally slow growing. There will be expansive masses of masses, and there will be pushing margin and enclosed within a fibrous capsule. So benign tumors are having fibrous capsule, they are enclosed. So they will be just slowly growing expansive masses. Benign tumors will never go into cancer. Now malignant tumors are usually rapidly growing. They invade the local tissues and spreading to distant sites. Malignant tumors are usually cancers. Now we can see benign tumors that are not cancer tumors, the tumor cells grow, that's all. They only locally grow specifically, and they cannot spread by invasion or metastasis. Whereas malignant cancer cells invade neighboring tissues. They enter the blood vessels and metastasize to different distant sites. So these are the characteristics. So normal cells will have DNA damage, and they have mutation on genome of somatic cells, and then alteration of genes that regulate the apoptosis will take place by somatic mutation genomes, and then activation of oncogenes will take place by mutation on genome of the somatic cells, and then the activation of oncogenes will lead to the expression of altered gene product, and that will lead to the malignant neoplasm. And alteration of genes that regulate apoptosis leads to expression of altered gene products, and the mutation on genome of somatic cells lead to inactivation of suppressor genes that will lead to expression of altered gene product, and that again leads to malignant neoplasm. And the telomerase activity, I told you, increased survival of telomerase leads to clonal expansion of altered cells. The beginning of cancerous growth is like this. It starts at one place, and slowly it will be multiplying and multiplying, and the underlying tissue also is involved by neoplasia. So invasion and metastasis will take place like this. Cancer cells invade surrounding cells and blood vessels. Cancer cells are transported by the circulatory system to distant sites, and then cancer cells re-invade and go at new location. So this is invasion and metastasis. So why cancer is potentially dangerous? Because at one place they will start and enter into brain in distant metastasis. The melanoma cells travel through blood cells, and the liver cells are affected. The melanoma is an initial tumor in the skin, and they will transformed into metastatic cells. They will invade the liver, brain. So what causes cancer? Some chemicals will cause cancer is one option. Radiation will cause cancer, that is another theory. And the heredity, diet, and hormones also lead to cancer. and some viruses or bacteria leads to cancer. Now, etiology, cause of cancer. Number one, genetic factors. All said and done, genetic factors. Number two, hormonal factors. Racial and geographic factors. A particular race is involved in and prone to get cancers. And a particular type of people confined to live in particular geographic region are definitely or sometimes get a type of cancer. Then environmental factors, then chemical factors, age, age predisposition leads to cancer. In sex, certain of the cancers are more prone for male people and certain of the cancers are more prone for female people. Heredity can affect many types of cancer. Inherited conditions that increase risk for cancer are hereditary retinoblastoma. The type of the cancer is retinoblastoma. And xenoderma pigmentosum is the type of cancer that affects the skin. Wilms tumor, that's the type of cancer affecting the kidney. Lee-Frommeni syndrome, that is the type of cancer leading to sarcomas, brain tumors, breast tumors, and leukemias, blood cancers, white cell cancers. Familial edematous polyposis, polyps, lots of polyps. Polypoidal growths will be invading colon and rectum, and some of these will undergo the cancer changes. Paget's disease of bone and the bone cancer will lead to the bone cancer. Fanconi aplastic anemia that will lead to the leukemia and the liver cancers and skin cancers. So these are the inherited conditions that increase the risk for cancers. And that's why we know that heredity can affect many types of cancers. So carcinogens, you should know what are the things that leads to cancer. Number one, radiant energies, ultraviolet rays, X-rays, and gamma rays. They will form pyrimidine dimers and they will lead to DNA cross-linking and they will go into free radical generation. And the chemical agents are 80% of the cancer is caused by the chemical exposure that can occur due to occupational profession. And the diet that we take, lifestyle that we use in day-to-day life, like cigarette smoking, tobacco chewing, alcohol consumption, and therapeutic drugs. Some of the drugs that we know knowingly or unknowingly lead to cancer. So chemical carcinogens, the different types of classes are there. Number one, polycyclic aromatic hydrocarbons. And the compounds including the polycyclic aromatic hydrocarbons are benzopyrenes, dimethyl benzanthracene. So these are the three compounds. These are the two compounds, benzopyrenes and dimethyl benzanthracene. These are the two compounds included in the polycyclic aromatic hydrocarbons. And aromatic amines, acetyl aminofluorine and aminobenzene. These are the two compounds included in aromatic amines. And nitrosamines, dimethyl and diethyl nitrosamines. So these are included in the nitrosamines. The drugs, cyclophosphamide, anti-cancer drug itself. Naturally occurring compounds like aflatoxin B1 and lactinomycin. Aflatoxin, you know pretty well, that will be abundantly present in the spoiled, fungally contaminated groundnuts, yellow colored groundnuts. Inorganic compounds like arsenic, asbestos, beryllium, cadmium, and chromium. These are all involved in various professional problems. The people who are working with this arsenic, asbestos, beryllium, cadmium, and chromium, these are the inorganic compounds that will lead to the development of cancer. Now you see the smoker's lung on one side, the black one, and healthy lung on other side, the gray one. So lung cancer is associated with the habit of cigarette smoke. Cigarette contains many carcinogens The most important group of carcinogens are benzopyrenes. Other important deleterious substances in cigarette smoke are nicotine, carbon monoxide, nitrogen dioxide, and carbon soot. So these are the classical picture of, you can find it in your anatomy museum, the smoker's lung and healthy lung. When you are going into a slaughterhouse, you can see the, of course, animal lung, and most of the animal lungs will be grayish, white, pale yellow. There will not be any problem. So that is healthy lung, and smoker's lung, of course, will be black. The incidence of lung cancer is increased to 15 times more in persons smoking 10 cigarettes per day. So if a fellow is taking 10 cigarettes per day, that is one small box of cigarette, then he is 15 times more risking himself to get the cancer. A non-smoking spouse of a heavy smoker will have 5 times more probability to get a lung cancer than a non-smoker. So suppose a husband is smoking 10 cigarettes per day, the wife inside the house should be inhaling the same smoke, cigarette smoke, inside the house, inside the bedroom. So this is known as passive smoking. The wife is not smoking, but she is inhaling the same smoke, and the husband is smoking inside the bedroom and inside the living room. Oral cancer is strongly associated with chewing of tobacco, mutagens, and carcinogens. Any substance which increases the rate of mutation is known as mutagen. All mutagens are carcinogens. Examples are radiations like X-rays, ultraviolet rays, gamma rays, and chemicals like benzopyrenes, aflatoxins, hormones like estrogens. So estrogen also is paving path for the cancer. So industrial pollution. So chemical carcinogens in the workplace lead to the cancer. So arsenic in mining industry, in pesticide workers, it leads to lung cancer, skin cancer, and liver cancer. And asbestos is a carcinogen that will be seen in the construction workers. The asbestos dormer sheets they will be preparing by compressing the asbestos dust. So they will lead to lung cancer and mesothelioma of the lung. Very dangerous and highly malignant mesothelioma. Benzene, the petroleum workers, rubber workers, and chemical workers. You know how the latex is getting collected. You can see it in your YouTube. And they will cut a slot across the rubber tree, and they will put a small cannula like thing, a sheet like thing, and they will put a bucket under that. All the latex will be collected in the rubber, and then it will be beaten by adding some of the chemicals, and then it will be forming a black type of sheets, and all these sheets will be laid and packed, and they will be sent it for further processing. So petroleum and rubber and chemical workers, they are exposed to leukemias, white blood cell cancers, chromium, metal workers and electro-operators, and chromium for they will do the small electrodes will be attached to one another in big computer labs. And these people who are working with the computer labs and connecting each other computer softwares, they will be using the chromium, and this will lead to the lung cancer and skin cancer also. Leather dust, the people who are exposed in shoe manufacturing to a lot of leather dust, and they lead to nasal cancers and bladder cancers also. Naphthylamine, so it's a chemical occupational and dye manufacturers and rubber workers. So the naphthylamine will lead to the bladder cancer. Radon, underground mining, lot of radon will be there in the underground mine. And this radon will lead to the lung cancer. And soot, tars, and oils, the occupation of coal, gas, and petroleum workers, they will be exposed to a lot of soot and the tars and oils. So they will lead to the lung cancer, skin cancer, and liver cancer. Vinyl chloride, rubber workers, polyvinyl chloride manufacturing people, they will be exposed to vinyl chloride, and this vinyl chloride will lead to the liver cancer. Wood dust, the people who work with the furniture manufacturing, a lot of machines are now coming down fast. So the wood dust will be just rising up and up. Unless and until they put 2 or 3 thick cloth around their mouth and nose, they cannot get the prevention from the wood dust entering into the nasal and the lung. So they will go into nasal cancers. So carcinogenic mutation. The mutation may not be lethal, but may alter the regulatory controls. So such a mutation is a in a somatic cell may result in uncontrolled cell division leading to cancer. So the mutation may not be lethal, but it may alter the regulatory controls. So such a mutation in a somatic cell may result in uncontrolled cell division leading to cancer. So this is the Ames test to detect mutagenicity. So Salmonella strain, it requires histidine for growth. So add a chemical mutagen for testing. And then the media with minimal histidine, a high number of reverterants, histidine negative to histidine positive, shows that the chemical tested causes mutations. And the control period without mutagen shows natural reverterants. So Ames test is used to detect mutagenicity. So cancer prevention with a lot of taking antioxidants is most important. So it prevents and it scavenges free radicals. It can detoxify carcinogens. Antioxidant vitamins like vitamin A, vitamin E, vitamin C, vegetables and fruits. And we are not advised to take the drinks. We have to take the vegetables and fruits as it is. We can chew them. But the people who are bedridden and the people who are not having teeth in the mouth, eating to the old people, then you can think of doing the fruit juice. Anti-mutagens. These are the substances which will interfere with the tumor promotion. Vitamin A and carotenoids are shown to reverse precancerous conditions. Even though we are exposed to precancerous conditions, vitamin A and carotenoids will reverse the precancerous conditions. Vitamin E acts as an antioxidant and it prevents the damage made by free radicals and superoxides. Vitamin C, you know pretty well, at least 60 milligrams of vitamin C is needed by all the people. If you take 100 milligrams, it's well and good. And the high doses of vitamin C, you know pretty well, is very much taught by many of the researchers to prevent the production of cancers. Vitamin C prevents the production of new cancer cases in aniline workers. Curcumin is present in turmeric. It is known to prevent mutations. That's why a little bit of curcumin in turmeric is very, very helpful in prevention of cancers. And fiber content of diet is beneficial to decrease the colon cancers. We have soluble fiber and insoluble fiber. All said and done, insoluble fiber will promote the catharsis. Unnecessarily, it will lead to loose motions. Whereas the soft fibers, which are part and parcel of the natural fiber content of the legumes, They are beneficial and they decrease the colon cancers. That's why we should not go for the polished pulses. You have to go for the home pound pulses, having a little bit of skin seeds. So flavonoids, they possess anti-mutagenic properties, and phenolic compounds found in the fruits like grapes, grape seeds, strawberries, walnuts. These are found as anti-mutagenic. So a quick review. Anti-mutagens are substances which will interfere with the tumor promotion. Vitamin E and carotenoids are shown to reverse precancerous conditions. Vitamin E acts as an antioxidant. It prevents the damage made by free radicals and superoxides. Vitamin C prevents production of new cancers in aniline workers. Curcumin and turmeric is known to prevent mutations. Fiber content in diet is beneficial to decrease colon cancers. Flavonoids possess anti-mutagenic properties. And phenolic compounds found in fruits like grapes, grape seeds, strawberries, walnuts, they are found to be anti-mutagenic. So this is PET scan, an example. The heart activity is shown in the normally in PET scan. Positron emitting tomography, that's the PET scan. And a tracer in the bladder, that's normal. And then various types of bladder and bones and iliac bones, all these things are showing deposits. The activity is going on there. So PET scan, cancer nodes are shown there, and cancer in the breast are shown in the breast area, and there is an implant in the breast. So some of the people will go for implant. That implant is shown here, normal right breast with the implant in place, and the left breast also is having implant, but cancer is there in the breast. So woman with breast implants and small cancers in left breast and nodes, and the tumor node T2 and node 1 rectal cancer. PET scan. So categories of DNA modifications. There are various types of genes involved in cancer. Oncogenes, tumor suppressor genes, and stability genes. These are the various types of genes involved in the production of cancer. So oncogenes. So what are oncogenes? These are the genes capable of causing cancer. Michael Bishop and Harold Warmus. These two are the Nobel laureates. They are the pioneers in the oncogene research, and they are awarded Nobel Prize combinedly in 1983. So the Michael Bishop, even though he did it, he invented it in 1936, over a period of 50 years, his research was kept in silence until and unless Harold Warmus, who was later on born after Michael Bishop, together they did research, and another Nobel laureate, he came and worked out to that. So cancer-causing agents, they will be entering into the as a proto-oncogene, and the DNA will be activated in the oncogene, and the cancer cell will ultimately present. Oncogenic viruses. Oncogenic viruses contain either DNA or RNA as their genome. Integration of viral genes into the host DNA overrules the regulatory checks and balances of cellular mechanisms that lead to transformation. So the virus Epstein-Barr virus, that is abbreviated as EBV. Wherever you see EBV, you can pronounce Epstein-Barr virus, EBV. The associated cancers are Burkitt's lymphoma, nasopharyngeal carcinoma, and human papilloma virus, HPV. uterine cancers and cervical cancers, human papillomavirus. Hepatitis B virus, HBV, that will lead to hepatoma, primary hepatic cell carcinoma. Now, Renato Dalbecco, Nobel Prize in 1975, and he was born in 1914. The transfer of viral genes to a cell is mediated by an enzyme called reverse transcriptase. More precisely, RNA-dependent DNA polymerase. Instead of having a big name, RNA-dependent DNA polymerase, we call it just reverse transcriptase. That was researched by Renato Dalbecco, and he was awarded in the Nobel Prize for this research in 1975. So this reverse transcriptase, they enter into DNA, later incorporated into the host genome. So viral DNA attaches to the host DNA, and the strand will be transferred, and DNA repair and virus integration, and virus is integrated into the host DNA. So different types of viruses and cancer. Viruses promoting human cancers, and these include both DNA viruses and retroviruses, and type of RNA viruses also. So virus, Epstein-Barr virus leads to Burkitt's lymphoma. Human papillomavirus leads to cervical cancer. Hepatitis B virus leads to liver cancer. Human T-cell lymphotrophic virus leads to adult T-cell leukemia. Kaposi sarcoma associated with this virus leads to Kaposi sarcoma in HIV/AIDS. And he is the pattern Bruce. And this young man in 1910, he found the first retrovirus in chickens, filtered sarcoma. The sarcoma will be seen in the neck region of the chickens as a huge sac. And he separated he slowly dissected the sac, and then he prepared a fine silicon triturate of this sac, and then he ultrafiltered it, and cell-free filtrate he injected into the tissues, and then he was successful to grow first retrovirus producing sarcoma. So he got the Nobel Prize in Physiology and Medicine in 1966 after 56 years of his research. And all those years it was just lying in dormant state. Nobody realized his work. And after 50 years of waiting, his work was realized. DNA tumor viruses. Viruses can contribute to cancer by inserting the DNA into chromosome in the host cell. Insertion of viruses DNA directly into a proto-oncogene may mutate the gene into an oncogene, resulting in tumor cell. And the mechanism of chemical carcinogenesis, pro-carcinogen, that is proximate carcinogen, and ultimately it becomes ultimate carcinogen. So pro-carcinogen induces the proximate carcinogen, and then it becomes ultimate carcinogen. It binds covalently to macromolecules, including DNA and RNA and other proteins. Carcinogens are electrophiles. They don't have electrons. They will be deficient of electrons at some peripheral stages. And that's why they are readily attacking the nucleophilic groups of DNA. That's the feasibility. Proto-oncogenes are activated to oncogenes by various mechanisms. There are 5 mechanisms. The one is promoter insertion. Number 2 is enhancer insertion. Number 3 is chromosomal translocation. Number 4 is gene amplification. Number 5 is point mutation. So these are the 5 things, 5 mechanisms. The proto-oncogenes are activated to oncogenes by all these 5 mechanisms. Promoter insertion, enhancer insertion, chromosomal translocation, gene amplification, and point mutation. So initiation and promotion. Initiator is benzopyrene. No tumor will be produced by just initiator benzopyrene. and the benzopyrene plus the promoter proton ion leads to the formation of tumor. So promoter is proton ion and then initiator is benzopyrene, no tumor. So first we should have initiator exposure and then the promoter should be applied onto the skin. So it takes a lot of time, repeatedly it should be applied. Then only the tumors will form. So this is the thing, initiation and promotion of tumors. A variety of compounds like phenobarbital and saccharins can act as promoters. The phenobarbital, they will be inducing um, they'll be inducing the various types of um, proteins, and these proteins will be going on the heme proteins. So the heme proteins will be going on acting, and this heme protein will lead to the formation of cancers also. Active agent of proton ion is a mixture of phenol esters. So enhancer, insertion, Mike genes which are inactive, and Mike genes with provirus, Mike C mRNA. Mike acts as a DNA binding protein and offers the gene expression. Gene translocation. Reciprocal translocation in Burkitt's lymphoma. Translocation is from short arm of chromosome 8 to short arm of chromosome 14. And in reverse process, some translocation occurs from short arm of chromosome 14 to chromosome 8. This is known as reciprocal translocation in Burkitt's lymphoma. Translocated piece from chromosome 8 contains Mike gene, which is placed next to gene transcribing H chain of immunoglobulin and itself become inactivated. And gene amplification. Amplification of genes causing increased expression into many folds. Amplification of certain genes are found in some tumors. It can be induced by certain anti-cancer drugs which causes drug resistance. And treatment with methotrexate also is one example. Point mutation. Point mutation is observed in some cancers. So CRAS P25 and GTPase activity and diminishes the activity of adenyl cyclase. And CRAS P21 mutation at the 12th position and loss of GTPase activity leads to overstimulation of adenyl cyclase. So this is the insertion of proto-oncogene, point mutation within the gene, normal amount of hyperactive protein and leads to point mutation. Proto-oncogene, multiple copies of the gene will be, excessive amount of normal protein will be leading to DNA amplification. The proto-oncogene affecting the gene, proto-oncogene moves from normal location to the different location on other chromosome. New location could activate and convert the gene. Excessive amount of normal protein will lead to translocation. Polypeptide growth factors are mitogenic. Growth factors are polypeptide substances secreted from different cells which causes mitosis. Growth factors may be endocrine, paracrine, and autocrine. Growth factors act on mitosis via transmembrane signal transduction. Now various types of growth factors. So the growth factors are EGF. The source is mouse salivary glands. Function is it stimulates growth of many epidermal and epithelial cells. And erythropoietin. The source is kidney and urine. The erythropoietin is produced by the kidney cells. So they will induce the hemoglobin production. So development of heavy erythropoietic cells that will lead to immature cell production. IGF-1 and IGF-2 in the serum. Sulfate incorporation into cartilages is mitogenic for chondrocytes and exert insulin-like effects on many cells. And the transforming growth factor A, tumor cells and placental cells. They are just similar to TGF. TGF-B in placenta and platelets, inhibition of hyperplastic platelets. Platelet-derived growth factors, they will be the source of platelets, accelerate wound healing will be there. That's why the people are separating the platelets and injecting at chronic ulcers, at the site of chronic ulcers, to accelerate the wound healing, and which is having profound benefit to the patients, and hospitalization is decreased. Nerve growth factors, submaxillary gland, and growth of sensory neurons. So familiar growth, human growth factors are EGF, submaxillary gland, kidney, and duodenal gland. EPO, kidney. HGF, placenta. IFN, gamma, activated TH1 and NK cells. IGF, placenta, primarily liver and plasma. NGF, neurons, submaxillary glands. PDGF, platelets and endothelial cells and placenta. PGF alpha, tumor cells, transforming cell and placenta. TGF beta, activated TH1 cells, T helper cells, and natural killer cells, NK cells. VEGF, smooth muscle cells and tumor cells. Mechanism of action of growth factors, binding to membrane receptors. So they will be binding to tyrosine kinase activation, lead to intracellular related protein phosphorylatase, and then intranuclear transcription factor activation. And that will lead to genetic transcription. And another route is the binding to membrane receptor leads to production of second messenger, and that is protein kinase activates intracellular related protein and go through the internuclear transcription factor and genetic transcription. And another thing is binding intracellular receptor will lead to the growth factor receptor hormones activation related gene, and that will lead to genetic transcription. So these are all the various routes by which action of growth factor comes out. Tumor suppressor genes. Genes which prevents the causation of cancer are known as tumor suppressor genes, and these sometimes called as recessive oncogenes or anti-oncogenes. So you should be very clear about these oncogenes. Oncogenes, mutation in one of the allele is sufficient, and the gain of function of a protein that signals the cell division, and mutation in somatic cells which is not inherited, and some tissue got preference. And tumor suppressor genes, mutation in both the alleles is required. For oncogenes, only one allele mutation is needed. For tumor suppressor gene, mutation in both the alleles is required. For oncogenes, gain of function of a protein signals the cell division. In tumor suppressor gene, loss of function of a protein is most important. In oncogenes, mutation in somatic cells that is not inherited is most important. In tumor suppressor gene, mutation in germ cells which is inherited, that is most important. Some tissue preference is shown in the oncogenes. The tumor suppressor genes got strong tissue preference. Tumor suppressor gene, that is anti-oncogene, is a gene whose protein products inhibit cell division, thereby preventing uncontrolled cell growth. That is the cell cancer. So tumor suppressor genes act like brake in the pedal. So you can see the various brakes. So they will have inhibitory action on the receptor. They have the inhibitory action on the signaling engine. They have inhibitory effect on the transcription factors in the DNA, and ultimately cell proliferation. So this is the pedal brakes. Tumor suppressor genes act like pedal brake. RB gene. RB means retinoblastoma. The major function of RB gene is the regulation of cell cycle procession. So G0 and G1 phase RB gene is affecting the E to F and then DNA. S phase RB protein and the specific protein phosphorylation, E to F, DNA and mRNA synthesis. So hereditary retinoblastoma, the somatic mutation, somatic retinal cell, homozygous cell gives rise to tumors in retina. And the other way is sporadic retinoblastoma. In most of the cases, not all the cases, about 40% is hereditary retinoblastoma. Rest of the 60% are sporadic retinoblastoma. So here, somatic retinal cell plays the role. First, somatic mutation, And second somatic mutation leads the homozygous cell gives rise to tumors in the retina. So P53 gene, P53 protein is in the acidic region, and next follows the core region, and next comes the basic region. P53 gene encodes the protein with the molecular weight of 53,000 kilodaltons. That's why its name became P53 protein. So coding the restrained protein relating to cell cycle control. When tumor suppressive gene is related and mutated, there is an induced occurrence of tumors. RB gene and P53 gene. Biological function of P53 gene, most important, suppressing the cell cycle, suppressing the transformation function of some oncogenes, monitoring the cell DNA damage, inducing the cell apoptosis. So these are the angiogenesis, neoplastic cells leading to angiogenesis, and that will lead to the invasion of blood vessels, and the neoplastic cells going into degradation of basement membrane, interact with extracellular membrane, degradation of extracellular membrane, then invasion of blood vessels. This is a direct route, and indirect route through angiogenesis. So growth factors, angiogenesis, collagenesis, all these things lead to metastasis. The mutation inactivates tumor suppressor gene, cell proliferates. Mutation inactivates DNA repair gene. Mutation of proto-oncogene creates an oncogene. Mutation inactivates several more tumor suppressor genes leading to cancer. So cells are born and they live for a given period of time and then it should die. That's known as apoptosis. That's why apoptosis is known as physiological cell death. Nobody can be immortal. Man is mortal. Likewise, all the cells in the man are going to apoptosis, normal cell death. The physiological cell death is apoptosis. It is known as cell suicide, cell deletion, and programmed cell death. Out of all the things, it is programmed cell death is most appropriate name for apoptosis. So apoptosis, removal of superfluous, aged or partially damaged cell is done by apoptosis. The term apoptosis means dropping off, similar to the old leaf falling from the tree. Nuclear shrinkage, chromatin condensation, membrane blubbing, and stepladder pattern of DNA in electrophoresis are characteristic features of apoptosis. Apoptosis mediating genes, that is suicidal genes, that is oncosuppressor genes are CFOS, P53 and RB. Apoptosis protecting genes are BCL2 and some oncogenes. Stress, other stimuli activated certain cell surface receptors and cascade of activation takes place. Stress is most important. That's why stress-induced cancers are more common in nowadays. The final effect of mechanism of cell death is through the activation of capsaicin. So difference between apoptosis and necrosis. Apoptosis is a programmed cell death, while necrosis is the end stage of day-to-day wear and tear. So the normal cell goes to the chromatin nuclear collapse and membrane blubbing, and then cell contents are repacked and leads to apoptosis. Whereas the normal cell will undergo normal wear and tear, and the proteins will undergo breakdown, osmotic pressure will increase and cause cell swelling, and necrosis will lead to the cell lysis, and all the contents are released. So general features of apoptosis. A number of activities take place in apoptosis: occupational death receptors, dimerization of BCL2 family members, release of cytochrome C factors, activation of caspases, and activation of DNases. Oncofetal antigens. During the fetal life, certain genes are active, and the products of the protein are therefore produced inside the cell. During differentiation processes, these genes are gradually suppressed, and therefore the protein is no more present in adult cells. However, Along with the malignant transformation, de-differentiation occurs. And the gene is de-repressed and the protein again is expressed in the cell. And such products are classified as oncofetal proteins. Remember it very clearly. During the fetal life, a particular gene is active and the products of proteins are therefore produced inside the cell. But during the differentiation processes that continue, this gene is suppressed and therefore the protein is not present in the adult cells. But however, along with the malignant transformation, de-differentiation starts occurring and the gene is de-repressed and the protein starts again available in the cell. Such products are classified as oncofetal proteins. Examples are alpha-fetoprotein AFP that is shown in hepatomas and plasma embryonic antigen CEA in colon cancers, and they are generally serve as tumor markers. AFP for hepatomas and CEA for colon cancers. So embryonic antigens expressed in embryonic cells and the functional gene will be there, and gene is replaced, antigens are not expressed in normal life, and embryonal antigen re-expressed in tumor antigen, and gene is de-repressed that leads to malignant cells. These are known as oncofetal antigens. Tumor markers, they are overexpressed by malignant cells. They are usually normal cellular constituents that are present at normal or very low levels in the blood of healthy persons. They are also called as tumor index substances. Tumor markers are also known as tumor index substances. They are factors released from the tumor cells which could be detected in blood and therefore indicate the presence of tumor in the blood, in the body. So, applications of biomarkers in response to therapeutics, in prognosis, differential diagnosis, risk assessment, monitoring the progression, and therapeutic targets. So these are the types of 7 applications of cancer biomarkers. So we can do the therapeutic targets, screening, response to therapeutics, prognosis, differential diagnosis, risk assessment, and monitor progression. So when they are useful for screening, for early detection, most important, and then to monitor, and then to diagnosis, and then to screen. So types of biomarkers are diagnostic types of disease, and then pharmacodynamic and predictive, prognostic. All these things are. So definition: a characteristic that is objectively measured and evaluated as an indicator of normal biological processes, pathogenic processes, or pharmacological responses to a therapeutic intervention. That's the definition. A naturally occurring molecule, gene, or characteristic by which a particular pathological processes, disease, etc. can be identified. The biomarker is a measurable indicator of the severity or presence of some disease state. A biomarker is anything that can be used as an indicator of a particular disease state. So tumor marker. So tumor markers are classified into enzymes, hormones, proteins, oncofetal antigens, genes, carbohydrate antigens, blood group antigens, and receptors. So tumor markers are wide variety of things. So the groups, enzyme groups, hormone groups, protein groups, oncofetal antigen groups, gene groups, carbohydrate antigen groups, blood group antigen groups, and receptors. So now we can see. So breast cancers, CA 125 and CEA. Lung cancers, CA 125 and CEA. And stomach cancers, CEA. Colon cancers, CEA. Prostate cancers, prostate specific antigen. Testicular cancers, AFP and HCG. Ovarian cancers, CA 125 and CEA. Pancreatic cancer, CA 125 and CEA. Liver cancers, alpha-fetoprotein. So common tumor markers are oncofetal products, alpha-fetoprotein. Serum levels are increased in hepatoma and germ cell cancers. Plasma embryonic antigen CEA The serum levels are increased in colorectal cancers, gastrointestinal cancers, and lung cancers. Carbohydrate antigens CA125 is increased in ovarian cancers of epithelial origin, and tissue antigens and tissue polypeptide antigens that they are indicating the general cancer role. Enzymes, alkaline phosphatase is increased in bone secondaries. Present type ALP, RAGON, is increased in lung cancers and seminoma. And prostatic acid specific PAP is increased in prostate cancers. Prostate specific antigen PSA is a specific one related to prostate cancers. More than 4.5 to 6 is a tag indicating the prostate cancer. Neuron specific enolase, that is indicating as a tag for nervous system tumors. Common tumor markers, hormones and metabolites. Beta HCG, choriocarcinoma. So choriocarcinoma got an alpha HCG and beta HCG. Alpha HCG is quite common, you will not be worried about it. The beta HCG is very specific. Calcitonin, medullary thyroid carcinoma. And big ACTH, lung port cell cancers. Vasoactive intestinal polypeptide, VIP, is adenomas, amine precursors, uptake, decarboxylation of mass. Vanillyl mandelic acid is the VME, that is the normal degradative product of pheochromocytoma, neuroblastoma. Hydroxyindolistic acid is carcinoid syndrome, and tissue catabolic product hydroxyproline is known for bone metastasis. ఇక్కడికి నేను గుర్తుపెట్టుకోవాలి. నెక్స్ట్ టైం ఇక్కడ స్టార్ట్ చేయాలి. ఇది ఎన్నోదో స్లైడ్ నెంబర్ తెలియదా? ఈ స్లైడ్ నెంబర్ ఓకే, పర్వాలేదు. థ్యాంక్ యూ. Okay.